When we give immunotherapy, the side effects, the rate of adverse events is lower than chemotherapy for sure, right? So that's a good thing. But there are severe grade 3-4 adverse events, but they're different, right? And it's really interesting because when you give chemotherapy, you're looking for neutropenia, infections, nausea, vomiting, all those kinds of things. The side effects of immunotherapy can be very, very subtle, and they can come on very slowly. And the ones that can be dangerous actually are colitis, right, which could come on just a little bit of diarrhea, a little bit of increased bowel movement, and it could proceed to something that's life-threatening. Actually, there have been fatal colitis in some of these trials, actually, not the ones I was talking about before. Other things like inflammation in the lungs, pneumonitis. Is this a cough? Is this the flu? Is the cancer progressing? We don't know. What I would like to have the take-home message is, if you suspect that a patient is having an autoimmune adverse event, you need to do two things, actually three things. So number one is you got to work it up, right? You really have to, you can't just kind of ignore it and hope it's going to get better. You have to really work it up with imaging studies and with appropriate labs. So that's the first thing. The second thing is you got to manage it, actually. And it's important to keep in mind that we're a little bit afraid of steroids because we think steroids are going to turn off the anti-tumor immune response. And you know what? That's completely untrue. So in large case series in melanoma, patients with autoimmune adverse events, if you manage them with steroids and their tumor is shrinking, it always keeps shrinking, okay? So I guess the other message is, don't be afraid of steroids. And then the third part of that message, I said there's three parts, is there's really nice algorithms that talk about this, right? And if you follow the algorithms and do what they say, usually you don't get into trouble.